So I guess, Julie, I'm going to ask you questions like, Kathleen was talking about the relationship between the patient and the caregiver and how it actually morphs into a different relationship
Yeah.
that they may not have ever had before. Do you think that there's a value or a need to set up boundaries or a way to kind of like help morph that relationship into a more stable environment so that everybody has a kind of a comfort zone, because you want the patient to be comfortable, but you also want the caregiver to have comfort during this time as well. So how would you address the patient and the caregiver to make sure that they kind of like maintain a sense of harmony through this
Yeah.
process?
Yeah, I think it's very important. And Kathleen has already touched on, so I'm still digesting all the wonderful things
Oh,
she
yeah.
said. But yes, I think that, that now this is a relational issue, right? So I think that it's very important for the caregiver and the survivor to be able to be honest with each other, right? Now, you might have a caregiver that you're not married to. You might have, there's all different sorts of relationships there. But I think we need to be honest about the impact that we have on each other, and to be able to say, I know you mean well, but I'm feeling overwhelmed. To be able to set the boundary in different ways. And I would say for the caregiver, as Kathleen mentioned, and I think we've all mentioned in some way, they can become so focused on the patient, on the survivor, that question, how are you doing, fill in your name, is almost more important for them because they're not even thinking about them at all. So I think that if you are a caregiver and the survivor has said, hey, I'm feeling overwhelmed, I need you to back off, then that's a cue that I need to take this energy, because a lot of times I'm doing that. One, yes, because I care, but also I'm feeling like I need to do something, that I need to control something. Mm-hmm. So then that's my cue to say, I need to go spend some time with myself and see how I'm doing. Because sometimes anxiety is driving that, or fear is driving that. So I need to go light a candle and sit in a room and talk to myself about this. And one of the ways I do that is on paper. How am I feeling? What do I need right now? And some people might say, well, I need this to be over. I need the person I'm caring for to be well and not have a diagnosis. And all of that is important stuff to observe. And when you start to write, like I said before, things pour out. So the boundary thing is really important, and knowing, I want to go control this and make sure this person is doing what they need to do, and, X, Y, and Z, but that person is telling me it's too much. So I need to go do something to take care of me and check in how I'm feeling. How's my body feeling? How, all of that. So I do think boundaries are really important. Yes.
So you were alluding to the fact that it's going to be over, that there's a point where it's going to be over. With prostate cancer, it's a little bit different. It's not that it's ever really over. It's kind of a continual process of just doing well.
Right.
Maybe staying the same is still okay. Maybe being slightly unwell, but you're still okay. So how do you, almost in a sense, find a way to have men convince themselves or check in with themselves to say that, you know what, I'm not perfect, but I'm still well. Not necessarily comparing things to other bad things in your life, but appreciating what you've got, appreciating where you're at, and appreciating the moment, kind of like living in that moment and still able to move on. How do you convince that mindset to be stable?
And first I want to just say, when the person is feeling, I want this to be over, I'm not saying that it will be, but I think it's a natural response to want it to be, right?
Sure. Yeah.
But to speak to what you're talking about, I think that one of the ways that I do that is to teach people. So yes, everything you said, creating that mindset and having the thoughts that I can say to myself, I can manage this, I can be well, even though I still have to, observe these things and pay attention. But one of the things that I do is I teach people how to be where they are. And I think when you can learn how to do that. So one day I'm feeling hopeful. Another day I'm feeling discouraged, or one morning I'm feeling hopeful and the afternoon I'm feeling discouraged. Our feelings flux and change. And I think the thing that builds the most confidence in people is when we learn how to be with our emotions in whatever they are. And I know how to take care of myself and wrap my struggles with a tenderness and a caring attention, that gives me the confidence to deal with whatever is going to come up. So it's not for me about getting in one place, although there's lots of benefit on having those statements to say to yourself and reminding yourself, but it's about how am I today and how do I care for these feelings that I'm having? And how do I create a gentleness, if you will, around myself and what I'm experiencing? And I think that creates a lot of strength and confidence for whatever comes next.